This lesson introduces strategies for providing intervention services designed to reduce the impact of ACEs after exposure has already occurred. Mental health providers are uniquely positioned to offer interventions that mitigate the negative effects of early adversity. But before selecting an intervention, a provider must complete a thorough assessment to determine whether a child has been exposed to trauma, the source of that trauma, and whether the child is experiencing any related symptoms. Don't forget that it can also be necessary to screen parents and caregivers to identify interventions they may need. Symptoms can include post-traumatic stress symptoms like emotional detachment, sleep disturbances, flashbacks, mental replay of trauma, depression, anxiety, and behavioral difficulties like engaging in high-risk sexual behaviors, using harmful substances, delinquency, and low academic achievement. It's imperative to note that ACEs are not deterministic. Because of the complex interplay between risk and protective factors, at each level of the social ecological model, some people with high ACE scores may be healthy and happy, while others may experience negative impacts due to ACEs.
Just because an individual experiences some adverse event, whether it's sexual abuse, physical abuse, whether it's intimate partner violence, whether it's sexual violence, it doesn't necessarily mean that each individual is going to have the same response to that. And so it's important in the screening process to find out whether an individual has been exposed to those things and then what their specific symptoms are. And then treatment can be tailored appropriately after one has determined what the specific symptoms are in response to that event.
Oftentimes I'll tell patients that just because a symptom exists doesn't necessarily warrant an intervention if you're doing a great job of coping with it. And so you'll want to look at disruptions in their ability to work, play, or learn. And if those levels of functioning are not up to par, then that would be a good warning sign for them to say, hey, I may need to come in for some additional support.
This is also an appropriate moment to reiterate that an ACE score is not a diagnostic tool. An ACE score alone doesn't indicate the need for services, but you should remain mindful of ACE history when forming case conceptualizations and service plans.
Individuals who are exposed to adverse childhood experiences or have ACE scores that are higher than 0 or 1, it doesn't necessarily mean that those individuals need treatment. It also doesn't mean that those individuals are destined for lifelong negative health consequences. One of the things that is important to consider is whether an individual is having symptoms that result from exposure to adverse childhood experiences. So, are the individuals having symptoms related to trauma? Are they depressed? Are there anxiety symptoms? Anything that could cause concern for the mental health professional in providing treatment. If those things are present, then it is important for an individual to get the appropriate type of treatment.
Take a moment now to review some of the assessment instruments you can use to identify trauma and other symptoms that may result from exposure to ACEs.